to Sharif, and he's going to say hi and welcome. And I'm going to come back and say some other words, introduce you to some of our U.S. leaders here, and then we'll get started. But we promised to start at 12:10, and we're getting started now. So it's my honor to bring Sharif Said to the platform.
Well, what an honor it is to even welcome everybody from all over the world. So hello from our state, Texas, in the USA, but I know that there's people from all over the world that's joining us. And the reason why you're joining us is because of our incredible products, not only of what it's doing for other people, but the quality of people that it brings to the table. Right here in front of me on the other side of this phone is a doctor. And I know there's tons of other doctors that will be training on the incredible products of what it does for people's health, their wellness. But the truth is the reason why we are creating world harmony with these products is because of our cleanse, balance, build philosophy. It's an incredible philosophy that will always be the center and the core of what brings people to this company. We help cleanse the body. We help balance people's hormones and stress level, and we build them up, not from just a wellness and a health perspective, but for who they want to be. Because oftentimes when you take care of your health, it transpires to other parts of their life, and then you find out that other parts of your life are now secure as well. So it's an honor for me to say welcome to everybody. You're in for an incredible night, if it's for some, morning for others, and afternoons to some as well, because this is truly a live global event, which brings on another whole incredible feel. And a time where people are socially distancing, we are actually bringing people together in a magnificent way. And so congratulations for all of you for taking this first step forward, for coming to be on this event. And congratulations to Ben Peters for putting on this amazing event, this medical advisory event, if you will, so that you know the power of what you have in your hands and what you will put in your body. So Dr. Ben, thanks for, and excuse me, and Charles. And Charles is always the one that is our anchor, that's always planning this and putting everything together. Please, in the chat box, say, "We love you, Charles," over and over and over again, because honestly, without Charles, we would not be able to do things like this. He always keeps us in line and always works behind the scenes and always has that positive attitude that brightens our day every single day. So thank you too, Charles, and thanks everybody for being on. All right, everybody. Charles, back to you.
All right, that's really wonderful. Ladies and gentlemen, we're really so happy to have you here. Welcome to Pure Medical Symposium. We are really so glad that you could make it for this show. I promise you, this is the best place to be right now in the world. And we're so happy to have people all the way from the United States, people all the way from the continent of Asia, people all the way from Africa. We have Ghanaians here, we have Nigerians here, we have Kenyans here, we have Cameroonians here, we have South Africans here, we have Nigerians here. So this is going to be a powerful program. There is nothing as important as knowledge, because knowledge is power. So you're going to be learning so much about what has given Pure the edge and why you are with the fastest growing company right now. So ladies and gentlemen, welcome to Pure Medical Symposium. We're going to start immediately. I want to hand it over again back to someone that's actually very key. We've had his name over and over again, and that's because of amazing and massive work he's been able to do in Africa. And we're really so excited to have Dr. Ben for the amazing things he does. Dr. Ben Peter is the president Pure for Europe, Middle East, and Africa. And we're so grateful for his massive, massive track record and what he's doing presently. So, ladies and gentlemen, it's my honor this very moment to make welcome our very own Dr. Ben Peter.
Wow, Charles, thank you so much for that wonderful introduction. I mean, it is so important that we do things together just like we do right now. And you guys heard from Sharif, but you're about to hear from the best of the best. We have the best medical doctors from Africa. We have the best medical doctors from the United States. We have teams from South Africa. We have teams from Kenya, Cameroon. So it is truly an honor to be a part of this amazing program today. I want to say thanks to every one of you that's joined us today. Thank you for letting us come to your homes. Thank you for letting us come into your families, because we are working together to create a new reality all over the world. We are going to empower your bodies through our philosophy of cleanse, balance, and build, which would translate into a great business opportunity for you, because we know that when you got good products, you got good business. So I want to thank you once again for being part of this program. You're going to hear about two very special products today. The first one being PURXCEL. PURXCEL, we call that product Miracle in a Bottle. You're going to hear about PURXCEL. This is our flagship product in Africa that is changing lives and creating opportunities for people all across the continent. And you're about to learn about it today. And then secondly, you're going to hear about the new product that is coming to Africa through Nigeria, the Goyin. Goyin is a product that has been changing lives on all of our other markets. And now Africa has the opportunity to have these products in Africa. So what are some benefits of Goyin? Some benefits of Goyin, you know, it brings balance to your body, both physically and mentally. It helps support healthy energy. It helps, the clinical results that have shown that Goyin to be efficacious and effective. What are some benefits of PURXCEL? Obviously, cell immunity, anti-aging, performance, you know, oxidative stress. So you are going to be hearing about these two amazing products that will change your life. And for those of you who are business savvy, for those of you who want to take care of your families, you are going to be able to learn about the opportunities these amazing products offer to you. So I want to say thanks to Charles. I want to say thanks to all of our leaders. I want to say thanks to all the management staff in all the markets we're operating. We have the best of the best. You know, we are the fastest growing company in Africa, and you are part of something truly special. So Charles, thank you so much. Let's make this fun. Let's make this exciting. Let's change the world.
All right, thank you so much, Dr. Ben Pierre. That's really amazing. Thank you for that exposition on PURXCEL, brief exposition on PURXCEL and Goyin. Ladies and gentlemen, sit tight. This is really going to be a very beautiful and educative section. We have the best of the best in the house this evening, and I'm going to be inviting them one after the other. We are really so privileged. So I talked about PURXCEL right now. To take us deeper into the technology called PURXCEL, we're going to bring in one of our top best in the African continent. He's one of the top orthopedic surgeons. He's going to be taking us on a topic called the triactive technology of PURXCEL. Now, Dr. Ray Uwafo is an orthopedic surgeon from the Federal Medical Center, and he's going to be taking us on the triactive technology of PURXCEL. Ladies and gentlemen, it's an honor this evening to make welcome no other person but Dr. Ray Uwafo. Thank you, sir.
Wow. Good evening, Mr. Charles. I appreciate. Wow. And I want to thank our president, Dr. Ben in the house. I want to thank all the leaders and the Pure Corporate. I want to appreciate you for bringing this great opportunity to us in Africa. I personally, he knows that I'm a lover of PSL. And honestly, it's one of the products, it's actually what attracted me. I didn't come in because of the business, but actually I'm making money out of this. But I stepped in because of this particular product, the triactive technology called PURXCEL. I'm going to share my screen while I go into this. I think I will be enabled to share my screen.
Yes, you are. Yes, you are.
So try it. So sorry. Okay. So thank you everyone in the house. Appreciate everybody. And I'm not going to discuss PURXCEL the way we've been discussing it generally. We understand, like Prof. Ben said, the center of PURXCEL or pure products is to cleanse, balance, and build. And one product that this company also has that can fulfill or give us this entire philosophy of the company is PURXCEL. In PURXCEL alone, you can achieve the entire philosophy of the company of cleansing your system of toxins, balancing your pH, balancing your entire body, and building good health with what we have in this company. The components are sure, the components are there. The triactive technology comprising essentially the first ever available oral glutathione and also the superoxide dismutase and the aloe-acimannan. We're not even discussing about the other 15 complementary well-selected premium ingredients. Those products alone can be bottled and marketed as single products. but the company never considered that, everything it put together. But the science of the extractive technology I want to bring up here is the fact that everything in this particular product has good stories and researches backing them up. And no wonder they are this product is featuring. It didn't take time to feature in the prescribers or the physician's prescription manual in USA, PDR.net. And when the company also came to Africa, they were the first network marketing company. I'm a medical professional, the first network marketing company to penetrate and partner with the Nigerian Medical Association and Pharmaceutical Society of Nigeria. So what was that telling us? They didn't lobby their way in. They came on board because of the quality of the sciences backing up the product. So I'm excited to discuss a little about this particular product called the PURXCEL and the sciences behind it. You know, it's core integration of nutrition with medicine, and it's a paradigm shift. Health is moving towards the primary health care, because once your cells are healthy, you'll be healthy. So the body is targeting improving the health of the people through health promotion, and it is essentially among the top grade premium products in achieving that in healthcare world. So the role of PURXCEL, and then this is the link in the PDR.net. PURXCEL essentially, I'm going to talk about the 3 primary products or ingredients that made or gave it the triactive role that it plays. And one essentially is glutathione. I didn't have a slide to be telling us more about glutathione, and you can Google more of that if this is your first time of hearing about it. I'm not going to go into discussing essentially the superoxide dismutase as the 2 glutathione and superoxide dismutase as the primary endogenously produced antioxidants in the body that enables the body to recycle the other exogenous sources, the sources like your vitamin C, like your vitamin E, like your vitamin D, oleic acid. These are exogenous sources of antioxidants. And in the presence, or in the absence of adequate glutathione in the body, those ones will not function effectively because the action need to be potentiated by glutathione in the body, aside being the mother of all antioxidants, playing that role. But that's not all that achieves. It does also what we call inflammation modulation. This is not necessarily an anti-inflammatory role. It is to modulate what the system in controlling, balancing the pro-inflammatory and anti-inflammatory cytokines in the body, so you achieve the best you can achieve to maintain the optimal health in the body. That's the role. Anti-inflammatory modulation, then antioxidant role. It also played the immune boosting responsibility and cellular rejuvenation. Now, in the role in hypertension, studies have been going on all over the world. Over the years, the ingredients in these products have been attracting a lot of studies and researches. If you look at this study here, it shows that low glutathione metabolism in the body can contribute to a dependent increase in blood pressure. That is that story. They also see the role of superoxide dismutase in hypertension. This is the other primary antioxidants in this particular product called PURXCEL that gives it a triactive role. Look at this study by John Park. There's chronic treatment with superoxide dismutase in a model. This is actually an animal study though, but the study is published in the American Journal of Hypertension. The study demonstrated that the membrane permeable superoxide dismutase in this model has shown a reduction or attenuation or progression of blood pressure elevation in those models. So this phase associated with reduced vascular hypertrophy, decreased generation of oxygen radicals, and increased plasma antioxidant concentration. So we can see why this product is featured, this ingredient is featuring in PURXCEL, so that in a patient that's having resistance in hypertension, and you can add this in your normal antihypertensive management. I'm talking to doctors. You see that this can help you get a better response in your treatment. This is the way I want to go about this study. Now, you also see another study here. Sorry, I want to move this aside. You can also see another study here that shows a complementary therapy in diabetes mellitus. This study by Consuelo Borras is a more recent study in 2018. Glutathione metabolism type 2 diabetes and its relationship with microvascular complications and glycemia. There's reduced synthesis contributes to glutathione deficiency in patients with type 2 diabetes. And it is more marked in those with diabetic complications. So once all this has happened, what does it tell? There is consumptive oxidative stress in the body, and this leads to depletion of the glutathione, and so necessitating in a supplementation. And so supplementation invariably can ameliorate this depletion because the depletion is associated with increased complication, especially microvascular and complications in patients with diabetic mellitus. Okay, now this is also the role and glutathione in diabetes mellitus as well. You see deficiency in type 2 that impairs cytokine response. What this story is trying to show us, this is also one of the studies published in clinical investigation in May 2012. It's also a recent study. All those, the cytokines like interleukin 12 and interferon gamma production are impaired. And these are essential in microbacteria mopping off. And so because these patients have diabetic mellitus and there's low as a result of excess oxidative stress imposed by this particular condition, what happens are these patients are more prone to all these intracapsular and intracellular bacteria pathogen infections. Now, if you can augment this, if you can supplement this, which PURXCEL offers you as a clinician in managing these serious or severe infections in diabetic patients, you're going to have an improved result or a significant outcome while you are managing your patients who are to prevent them or save them from getting infected by all these intracellular bacterial infections. Now, there's also PURXCEL in superoxide dismutase role in diabetes. There are two studies here. One was a Nigerian study by Ojoye and Goye Briggs et al. This study was carried out in Port Harcourt here in Nigeria in 2016. It showed that superoxide dismutase and glutathione peroxide levels in patients with long-standing type 2 in Port Harcourt River State. So what does it explain to us? That type 2 diabetes is associated with decreased antioxidative status at these levels. And so what does this study tell us? It shows that it's recommended that antioxidant therapy be incorporated in the management and therapy of type 2 and diabetes to supplement the endogenous antioxidative system, as this could prevent or delay progression of the disease and the development of late complications associated with this. And that is the packaging in PURXCEL. That's why it gives you a retroactive technology. We're going to let us know that this time has come when you just treat your patients basically on the antihypertensive drugs and all the oral hypoglycemic agents or the insulins. You're going to find out, factor in all these things that are happening at the cellular level in the body to be able to get a balance and possibly get the best results. No wonder a lot of anecdotal studies we have not really reported, but we have seen a lot of anecdotal studies already on ground are showing improved, better significant outcome when those products are combined with our conventional care for these patients. Now, this is also diabetes and aloe-asimana. Are there studies on this? Yes. This is why Samena et al. About 2015, it showed the use of aloe vera extract in pre-diabetic patients could revert impaired blood glucose within 4 weeks. And if you can maintain this for about 8 weeks, it could alleviate their abnormal lipid profile. And you know that these two things usually go together, usually have hyperglycemia and hyperlipidemia, and each synergistically help in worsening the case for this patient, the microvascular injuries and the all the other complications associated with that. So this is the study that showed that, and this is high molecular, high molecular fraction, simply known as R-Simanal, can help to achieve, ameliorate this condition and prevent diabetic complications like hepato and nephrocalcitosis. Okay. Now, we also have other studies on this. Okay, we have PURXCEL in sickle cell diseases. We also have a study. This is also a study published in Pediatric Hematology Oncology. It's also a Nigerian study. And this study showed that the finding is that this study suggests that deficiency of some antioxidants, a lot of all these things, which are the exogenous sources that are potentiated by our endogenous ones, the deficiency associated with increased vaso-occlusive crisis in children with sickle cell. It's possible that those with more severe disease have an increased requirement as a result of oxidative stress. And so supplementation can go a long way in helping them. Another Nigerian study that's also published in PubMed about superoxide dismutase now and sickle cell disease also showed maintaining vascular hemostasis also contributes to the vital part that plays in modulating sickle cell pathology. And hence, superoxide dismutase supplementation would confer protection to the endothelium during acute and chronic oxidative stress events when these patients are having their crisis under stress, potentially reducing the incidence of pulmonary hypertension associated with sickle cell disease. And so we have PURXCEL and glaucoma. Is there any role? Could it support any complementary role? Yes, there are also studies. Ferreira et al. In their study in 2011 showed a relationship between oxidative stress and neurodegeneration that's got, though not very clear, but free radicals can act directly as neurotoxins or may also function as secondary messengers to spread the damage. So supplementation becomes good. We have the role of superoxide dismutase helping a lot. We know that glaucoma has multiple etiology and a very difficult condition to treat. But honestly, there have been studies that showed significant improvement when you incorporate some of these antioxidant products like superoxide dismutase, like your glutathione, which are the attractive technology in PURXCEL. We also have the PURXCEL role in cataracts, and then it also shows overexpression of superoxide dismutase 1 in whole length prevents hydrogen peroxide-induced oxidative damage, which causes cataract formation to the lens and subsequent control of gap junctions and protein kinase gamma. So all these things are important for us to understand. We also have neurodegenerative diseases or your Alzheimer's. Alzheimer's is one of the most difficult conditions to handle and to treat. To compare bioavailability, the effect on oxidative stress markers, and the safety of a new sublingual form of glutathione, no whichever form. We have also the orally available form in any form. Shows studies with this commonly used dietary supplements, including NAC and N-acetyl and glutathione. In this randomized cross study, this is actually a clinical study, double-blinded clinical study, has confirmed that this will help in reducing and possibly going down with conditions like Alzheimer's disease and all the other issues. And we have recently, during this COVID-19, so I didn't get that into this slide, during this COVID-19, there were studies that showed the support of vitamin D in enhancing and reducing the fatality of COVID-19 in the middle age and the elderly. You know, they are the most prone and affected that suffered the fatality of COVID-19, and vitamin D was central. But later studies, a more recent study showed, yes, vitamin D is central, but vitamin D is not going to do anything much in an individual with low cellular glutathione. So cellular glutathione becomes central in preventing fatalities in these patients who are having COVID-19 infection. Thank you so much. So lots of studies have incriminated oxidative stress in the pathology pathogenesis of many disease conditions. And these invariably connect antioxidants as role players. So they have confirmed some of these roles at individual levels and at the cellular level. The Triactive technology suggests comprehensive employment of these master antioxidants and all the other complementary ingredients, synergistically assisting them on nutrition to obviate the consequences of the exhaustion in certain high oxidative stressful conditions, as I just enumerated. Thank you so much for listening out. Mr. Charles, over to you.
All right, thank you so much, Dr. Ray Warford. That was really powerful. Thank you so much for this amazing informative section on Pure Excel and Empower. Wow, this is really amazing. Ladies and gentlemen, this has just been the first exposition on the Triactive technology of Pure Excel. And to take us deeper into this, we're going to be doing, Dr. Ben did talk about Pure Excel and a product called Goyin. And we are very privileged this evening to have one of the top in the world. She is a special one, and you don't want to miss this at this point. Ladies and gentlemen, we're going to be welcoming another doctor. She is a board certified physician. I believe the screen is going to be coming up so that you can actually get introduced to her. She's really going to give us an exposition on Goyin. So ladies and gentlemen, just permit me, let me just drop a quick information. You can link up on Facebook if you want to watch on Facebook. So please, if you have people that cannot get on Zoom, please, you can get onto Facebook Live and then you can join us. So right now, ladies and gentlemen, we're going to be bringing back up stage to Dr. Diane Crook. Dr. Diane Crook is a board certified physician for over 30 years. And she has practiced for over 30 years, a private practice at Lake Point Family Practice Clinic in Kansas. So we are really privileged to have her speak to us on super nutritional component of Goyin. I believe you've not seen Goyin before, so this is really going to be amazing. So ladies and gentlemen, it's my privilege this very beautiful day to reintroduce to you Dr. Diane Crook.
Hello, thank you, Charles. Can you hear me?
Yes, loud and clear.
I'm so grateful to be asked to be a part of this symposium. And I'm very appreciative of Charles inviting me, as well as Dr. Ben and all the people of Pure who I've enjoyed over the last several years as I became a part of this family, and really was just as a personal physician and a mom looking for healthier benefits for my own life and for my children's lives. And it turned me on to this company of Pure. And one of these products was Goyin. Goyin's been around now over 10 plus years. And I think I'm excited for your area and your country to get an opportunity to get access to this, to just continue to fill in those nutritional gaps that we're all looking for to help us stay healthy in this world that we're all living in. And I think, Charles, you're going to be in charge of my slides, correct? Yes? Yes. All right.
Yes. They're trying to,
right.
Okay.
So Goyin, this is based on traditional Asian medicine. And they used a formula that basically was to bring balance to our bodies and our lives. This is coming from traditional Asian medicine for over 5,000 plus years. And these are doctors that have tested and refined the art of balancing our body as a way as enhancing our overall health and well-being. Specifically, Goyin was searched and developed for the very things that we're all strategizing to alleviate stress, the imbalances of our lives. As it was pointed out earlier, Pure really was based on that philosophy of cleanse, balance, and build the body. So Goyin was specifically to address that one component of balance. And if there's ever been a time in our world where life has been so unbalanced, we all are living in that unbalanced world. So Goyin was there to unify, the benefits of Western science along with Eastern knowledge of getting those proper ratios and blending to create a perfect balancing blend. I love Goyin, very nice tasting because it is a proprietary blend of warm and cool superfruits, approximately 20 of those that kind of blend that balance of Eastern medicine with herbs and other fruits with the benefits of just all the numerous benefits that come along with all of those those food products. And Goyin's purpose is to address all the concerns that we all have into bringing our body into balance and to allow our body to heal itself. We are all meant to heal within and from without. We take for granted that a lot of our illnesses or injuries do heal, but there are a lot of people in the world that cannot overcome their illnesses, and we owe it to ourselves to educate them and recognize something as simple as Goyin put into the body will let the body do what the body's supposed to do, which is to let us get healed. This is healing at a function of the peak levels that we're all intending to be at. And this is formulated like no other, and it's an ability to induce an all-over systemic whole body balance, which really translates into all of us having an optimal and mental function. So the key benefits and the features of why Goyin was developed, and this was developed over 10 plus years. And so this has been on the market, at least in the United States, for over more than 10 years. And people are seeing continuous benefits, but it's for so many to support healthy energy, to enhance mood, support that balanced body that we're looking for, increases our vigor, intended to help reduce tension, sadness, fatigue. It too delivers that antioxidant protection based on all of those superfoods and superfruits that are part of it. Very high in vitamin B6 and B12, in which we all know that a lot of the vitamin Bs are really intended to give us that energy. And nutritionally depleted, I see people all the time that are low in our vitamin Bs. This is non-GMO and pure vegan supplement. So I'd like to go over a few studies that were initiated on this. They're not overwhelmingly large studies, but I think the point of it is that we're seeing such improvement when people do take the Goyin. So the purpose was to just evaluate this dietary supplement that's based on the Asian medicine on how people feel that their mood, energy is improving, their tension is reducing, their fatigue is going away. And so the causes of these imbalances in our world, or stress, as we all know, are all over the place. We know we all are right now living in an emotional, stressful time with COVID, and people are out of jobs, out of work, financially stressed. These are emotionally toiling on us. Physical stress, people are either not exercising, or to handle their stress, they're over-exercising their body. They're not sleeping well. And then we're not eating well either. We're at least where I live, a lot of people can get access to really processed foods instead of embracing a healthier dietary plan. And of course, environmental stress, constantly being imbalanced with just poor air quality, poor water quality, pollution in the air, overheat, too much cold. And I think all of this is just happening with everybody. We have that internal imbalance, external imbalance everywhere, unavoidable. You know, it's not a matter of asking patients in my practice, are you stressed? It's a matter of how well do you manage the stress? Because nobody can say to me with a straight eye that I am not stressed. If they say that, they probably need more Goyin. So let's take a look at what some of these studies showed. So they looked at two groups. They looked at a healthy stress subject, which were men and women in the ranges of 16 to 68. They were screened for the moderate levels of psychological stress. And then they also looked at a second group. These we considered the overstressed subjects. These were marathon runners, people running 26 miles for competitive racing. That puts a lot of physical stress, a higher physical stress than what most people go through, and just the fatigue and the depression of this intense exercise. And the test methods were there to see what their mood scores were before and after taking Goyin, with the healthy stress taking the supplement for at least 4 weeks, and the overstressed group taking the supplement for 2 weeks. And what they found, no surprise to me, at least what I've been seeing in my own practice and in my own family and friends anecdotally, that the global mood state improved significantly, up to 19% compared to the control group and the ones that took Goyin. That was statistically significant when you look at just the healthy stressed, which I call the traditional population. And then when we look at those that we consider overstressed, the high energy, high exercise individuals, again, just after 2 weeks, their overall mood state indicated a better overall mood by nearly 14%. And then when they looked at the different areas specifically of the subdivisions, including tension, depression, anger, the vigor, fatigue, and confusion, all the areas that we do not want to have, tension was down 24%, depression 15%, anger reduced by 11%, vigor increased by 47%, which is what we would like to see. Fatigue obviously dropped 42%, and even confusion improved, dropped 17%. And again, in the same overstressed individuals, we saw similar changes even after a 2-week test dose with Goyin. Significant reduction in tension, improvement in depression, reduction in anger, definite improvement in vigor, fatigue dropped, and so did confusion. So the conclusion from these results, in my primary care practice as a family physician, I am inundated on a daily basis of people that are stressed out, they're fatigued, and they can't explain it. And especially with the situational things going on in the world right now, I've never seen a bigger population of people with depression and anxiety. And what I love is that the overall effect that we're seeing initially with Goyin is seeing that the global mood score is improving significantly. And this is even data being equivalent to some of the pharmaceutical drug therapies that we offer, at least in the United States. And as you know, we're a small portion of the world population, 5% of the world population. But unfortunately, in my country, we're 85% of the pharmaceutical users. We have too many people that want a quick fix for a chronic problem. And so I love the fact that we've got something to offer the world that's outside of the pharmaceutical world. Cognitive behavioral stress management is also something it was compared to, and seeing those benefits from Goyin. And Goyin's balancing blend is effective in maintaining those healthy levels of energy and mood. We see that in the usual levels, the normal 1 ounce a day, though in some cases I'll add patients or people that are interested in Goyin. If they're overwhelmingly stressed and very depressed, I'll encourage them to take more of Goyin, take 1 ounce 3 times a day. What's beautiful about it, it's all superfruits, herbs, all natural food. So I never worry about anybody concerned that they're going to overdose on Goyin. It's food. And we love that it is there to help that individual elevate those physical or at least help reduce those levels of elevated physical and psychological stress. And in my own anecdotal experience that I'm finding, I have seen people with PMS, premenstrual syndrome, depression, improve with Goyin, especially women that are going through perimenopause or menopause that are suffering from hot flashes. Definitely, anecdotally, I've seen those women have a significant reduction in hot flashes. I'm one of those women. I was going through the change at the time I started on these products 6 years ago, and definitely saw a significant reduction in my overall hormonal imbalance. So it balanced back up and saw a reduction in my hot flashes. I've also used it in areas of where people have extreme stress. Recently, I had a young man that was suffering from proctalgia fugae, which is sad to say, stress-induced rectal spasming. We put him on Goyin a couple of times a day, and within a couple of weeks, he had almost complete reduction in his symptoms of the proctalgia fugae. His quote was, "You need to let anybody who suffers from this condition to look into Goyin." I've used it in people that may be in sadness or in mourning from death, and we know that some people can be overwhelmed by depression and grief. And anecdotally have also seen an improvement in how they handled their grief and their emotions with just the addition of Goyin. So for me, being involved with this company and seeing all the products that they've brought forward, I really feel confident as a family physician advising anybody to look at Goyin, look at the ingredients of Goyin, and know that we're seeing a tremendous success of helping people reduce their stress levels, improve the hormonal balance, which is what we're all in need of these days. As we mentioned with the PURXCEL, the physician's desk reference also has Goyin in, as it is a dietary supplement that even our own physician's desk reference in the United States, which is not easy to get into, is recommending that as a nutritional supplement. So I hope that I've given you just a little bit of a taste of what Goyin could do for your people, your friends, your family, your country, and really look forward to working with you in the future endeavors to continue to help everybody get healthier in our world.
All right, thank you so much. That was really wonderful. Thank you, Dr. Diane, for honoring our invitation. We're really so happy at the exposition you've given to Goyin. Thank you so much. So, ladies and gentlemen, it's really been an honor to actually listen to these great top professionals in their field. First of all, you heard from Dr. Ray, and now you talk about PURXCEL, and now you've heard from Dr. Diane talking about Goyin, and so we're really so excited. We're going to have the third paper immediately, and we're really so honored to have this top people speak about this. And we're going to be going into the topic called the application of antioxidants and anti-inflammatory agent in the management of chronic viral disease. And to take us on this topic is somebody that's really top of his field in Africa. He's not a person, but Dr. Tony Okoye. Dr. Tony Okoye is the public health specialist, the National Strategic Programs Manager for the NMA Pure Partnership. And we are really so honored to have Dr. Tony speak with us this evening. And so, ladies and gentlemen, I present to you Dr. Tony Okoye. Right. Thank you, Dr. Okoye. You need to unmute.
Hello. Hello, can you hear me?
Yes, loud and clear. Thank you.
Oh, good. Good evening, everybody. My name is Dr. Tony Okoye. Before I proceed with my lecture, I want to bring to the entire Pure family, Africa, global, the goodwill of the Nigerian Medical Association. It's been our pleasure to partner with this wonderful company that is revolutionizing the way we manage, clients with different conditions, chronic conditions in this new era, in the era of oxidative medicine. So I bring you the full package complement of the goodwill of the Nigerian Medical Association to this symposium and to the Pure Africa. Thank you. Quickly, I'll be going through my topic. The outline is introduction. Okay, the topic again is application of organic antioxidants and anti-inflammatory agents in the management of viral infections and chronic diseases. I will be rushing through the following outlines. Introduction to the pathogenesis of viral infection and chronic diseases. Please, if you lose me, let me know. The role of antioxidants and chronic viral diseases and viral diseases. Inflammatory process, the role of anti-inflammatory. I want to emphasize organic anti-inflammatory agents in the management of both viral infections and chronic diseases. What is viral infection? A viral infection is a proliferation of harmful virus inside the host as they cannot reproduce without the assistance of a host. They display tissue specificity or tropism. Viruses infect a host by introducing their genetic material into the cells and hijacking the cell's internal machinery to make their own particles. Symptoms of the viral illness occur as a result of cell damage or tissue destruction and the associated immune response. Their parasitic replication robs the whole cell of energy and macromolecular components, severely impairing the host's ability to function and often resulting in cell death. What is chronic inflammation? Inflammation ordinarily is very important to the body. It's the body's process of fighting against things that harm it, such as infections, injuries, and toxins, in an attempt to heal itself. When something damages our cells, our body releases chemicals that trigger a cascade of responses from the immune system. But it becomes chronic when this response lingers beyond few hours or days, leaving our body in a constant state of alert, leading to a negative impact on our tissue and organs. It is believed that chronic inflammation plays a role in a range of conditions from cancer to asthma and all that. These are few causes of chronic inflammation. If you don't treat an acute phase of inflammation, it gets chronic. If you have an injury, an infection, autoimmune disorder, long-term exposure to irritants, such as environmental pollutants, industrial chemicals, polluted air, smoking, obesity, and chronic stress, alcohol, all produce chronic inflammatory process in the body. How does chronic inflammation impact the body? Obviously, very negatively. Chronic inflammation, more often than not, leads to damage to healthy cells, tissues, and organs, and cascading over time to DNA damage, tissue death, and internal scarring. These are linked to the development of several diseases, including, again, cancer, heart disease, rheumatoid arthritis, type 2 diabetes, obesity, asthma, neurodegenerative diseases like asthma and all that, like Alzheimer's disease. How is chronic inflammation managed? Inflammation is, as we know, as we have also said here, is a natural part of the healing process. However, when it becomes chronic, it is important to get it under control to reduce risk of long-term damage. Some of the options commonly explored worldwide are divided into two groups: use of synthetic products of pharmaceuticals and use of supplements or organic products. Two broad divisions: use of synthetic pharmaceuticals or use of supplement or organic products. And under the synthetic pharmaceuticals, they have non-steroidal anti-inflammatory. They can give you relief, but on a long term, we are talking about chronic inflammation that will lead to so many other diseases. When on a long term, NSAIDs will give you serious adverse effects like peptic ulcer and NSAID-induced or related nephropathy, kidney disease. So taking those synthetic NSAIDs on the long run will harm the body as you're trying to solve one problem. If you choose to use steroids, it's still a danger. On a long term, the steroid will lead to vision loss, high blood pressure, and osteoporosis, and even immune suppression. That is for the organics, for the synthetic pharmaceuticals. Then if you use the organic supplements, here we strongly, unreservedly recommend pure products like PURXCEL Jelly Build, Miller Sleep Trim, etc. Supplements, certain organic supplements help to reduce inflammation. And all these things, curcumin, they are all in PURXCEL. For instance, curcumin is the active ingredient in turmeric. These are all related to reducing chronic inflammation and managing or bringing a balance to the oxidative stress associated with viral infection and their chronic diseases. So we recommend using organic supplements as on a long-term basis for management of chronic inflammation, which is also associated with viral infection, as opposed to using synthetic pharmaceuticals. So the role of oxidative stress. In all this, we have oxidative stress at the center. What is oxidative stress? It's implicated as a pathogenic factor in a number of viral infections and chronic conditions. It alters immune functions. Some researchers have also shown that nutritionally induced oxidative stress exacerbates the pathogenesis of certain viral infections. The change in virulence was found to be due to changes in the genome. Virus-induced activation of phagocytes is associated with oxidative stress, not only because of reactive oxygen species that are released, but also because activated phagocytes release pro-oxidant cytokines. It occurs when redox homeostasis within the cell is altered, okay, due to the production of reactive oxygen species, okay? If not strictly controlled, oxidative stress can be responsible for the induction of several diseases, both chronic and degenerative, as well as speeding up the body aging process and cause acute pathologies, like stroke. There's a consensus among researchers and clinicians that oxidative DNA damage is one of those stimuli responsible for cancer development. Therefore, we must think seriously about managing chronic inflammatory processes and also oxidative stress. Okay. Reactive oxygen species production basically relies on enzymatic and non-enzymatic reactions. That's why PURXCEL is so wonderful, because it contains a complementary synergistic systems of glutathione, which is non-enzymatic antioxidant system, and the superoxide dismutase, which is enzymatic. So they complement each other, and that's why PURXCEL is wonderful. Enzymatic reactions are able to generate reactive oxygen species are those involved in respiratory chain. Enzymatic reactions able to generate reactive oxygen species are those involved in respiratory chain, prostaglandin synthesis and phagocytosis, and cytochrome P450 system. The critical organs like kidneys, liver, heart, and lungs are negatively affected by the stress, mainly because of the fact that reactive oxygen species production induces recruitment of inflammatory cells and pro-inflammatory cytokine production, leading to an initial inflammatory stage. When viral particles gain command of the cellular mechanism and production of more progenies, the inflammatory response exacerbates into an overdrive or cytokine storm and its sequelae. This is exactly what happens in COVID. I'm happy that my colleague, Dr. Iwafa, mentioned my personal experience in managing COVID cases within this period using PURXCEL, okay, and Daily Build has been so wonderful, because they modulate the overdrive, the inflammatory overdrive that leads to, that is interpreted as cytokine storm, which is at the center of the morbidity associated with COVID-19. Glutathione, then the roles of the organic antioxidants and anti-inflammatory agents are: one, glutathione, which is a tripeptide, containing cysteine, glycine, and glutamate, and one of the most abundant antioxidant preventing oxidative damage of cells from reactive oxygen species. Maintenance of highest concentration of reduced glutathione in most cell types highlights its vital and multifunctional roles in the control of various biological processes, such as detoxification, neutralization of viruses, regeneration of other antioxidants like vitamin C and E. Of course, it has antiviral action, mitochondrial function, regulation of cellular proliferation, etc. Oxidative stress is induced once there is an imbalance between the generation and neutralization of reactive oxygen species. It plays crucial roles in a variety, that is, glutathione plays crucial roles in a variety of natural and disease processes. Infections by various viruses trigger oxidative stress, chronic inflammation, etc., which affect both the cellular metabolism of the host cells and the life cycle of the virus. Another powerful endogenous antioxidant, which is organic, relevant to our discourse today, is the superoxide dismutase, which constitutes a very important antioxidant frontline defense against oxidative stress. So my essence, what I'm saying is that viral infections, chronic inflammations are sent with oxidative stress are central to the formation or progression and the poor prognosis of many diseases that I've listed. Many of the common chronic diseases, diabetes, cancer, asthma, and all that. So you need to use, because if you limit yourself to the use of synthetic pharmaceuticals, you're going to create additional problems for your patients. You're going to do a complementary use of natural organic supplement, and I recommend unreservedly the range of pure products, especially the PURXCEL, which contains glutathione, contains SOD, and S-many. So SOD is used in cosmetics. It has been reported that SOD has an important link in several human health problems, including RBC-related disorders, cystic fibrosis, and so on. Furthermore, a strong association between the activity of SOD and Alzheimer's disease has been suggested by researchers, and I'm sure one of my co-presenters mentioned that. So with PURXCEL and its triactive technology, we can deal with neurodegenerative diseases like Alzheimer's and so many others. Okay. Let me just mention, emphasize a little bit on SARS-CoV-2, which is the virus causing COVID-19. Antigen presentation subsequently stimulates the body's humoral and cellular immunity, which are mediated by virus-specific B and T cells. Though there are so many reports, in this period of era of COVID-19, but there are general consensus. There is a growing consensus from many researchers on SARS-CoV-2 responsible for COVID-19 about some major ways of its pathogenesis, which include direct cell injury through replication of the virus, pulmonary edema. In response to the pulmonary edema, which is inflammation, the lungs attempt to fight back, thereby releasing its soldiers of cytokines guarded by chemokines in massive manner, characterized as a storm. The pulmonary edema further obliterates the blood oxygen exchange in the lungs and precipitates hypoxemia, which is the cascade leading to more hypoxemia. The SARS-CoV-2 decouples the ion in the heme complex of the RBC, making it impossible for the RBC to pick up oxygen. Hypoxia leads to ischemia and possible thrombus formation. Inflammation leading to pulmonary thrombus appears to be the current understanding of the fatality trigger in COVID-19. The inflammation does a great deal of tissue damage and creates ground for thrombus formation, because the main problem is not the virus, but the immune hyperreaction that destroys the cell where the virus has gained entry. Conclusion. From the current understanding of the pathophysiology of COVID-19 as an example of a viral disease, we can glean the peculiar place for both antioxidant and anti-inflammatory organic agents. It is also more beneficial to conclude that early or routine supplementation of antioxidants using natural supplements and anti-inflammatory agents in both the healthy cohorts and those with age-related depletion, such as due to pre-existing comorbidities, will be one of the options in the fight against COVID-19. We need to replace the glutathione level, SOD level in patients exposed to COVID-19 and other chronic diseases and viral infection. It will help the body to rebuild and heal itself at cellular level. The use of bioavailable glutathione or its precursor NAC and SOD fortified with allo-S-many as formulated in PURXCEL in a very potent fixed dose combination is strongly advocated. Natural SOD levels in the body drop as the body ages. Hence, one becomes more prone to oxidative stress related diseases with age, necessitating supplementation with organic ingredients as seen in the range of pure products, especially PURXCEL. An extensive search by some scientists in Russia showed, has reached a conclusion as follows: that glutathione deficiency is exactly the most plausible explanation for serious manifestation and death in COVID-19 infected patients. The major risk factors established for severe COVID-19 infection and related glutathione deficiency found in COVID-19 patients with moderate to severe illness have further reinforced the conclusions that oxidative stress contributes to hyperinflammation of the lung, leading to adverse disease outcomes such as acute respiratory distress syndrome, DIC, disseminated intravascular coagulopathy, multi-organ failure and death, MICS, as seen in children in US. Poor antioxidant defense due to endogenous glutathione deficiency as a result of decreased biosynthesis or increased depletion of glutathione is the most probable cause of increased oxidative damage of the lung, regardless of the cause of the deficit, like aging, chronic disease, comorbidity, smoking, etc. The above conclusions provide novel insights into the etiology and mechanism of response and mechanisms responsible for serious manifestations of COVID-19 infection and justifies promising opportunities for effective treatment and prevention of the illness through glutathione and SOD routine supplementation. And I make bold to conclude here that for the effective management, for a better prognostic outcome, for a better quality of life, what we call that is the disability adjusted life years, for us as clinicians, as physicians, to be able to give to our clients and patients a better value, a better disability adjusted life years. It's good that we combine, just like my colleague, Dr. Iwaku said, we combine the orthodox medical pharmaceuticals with organic supplements, such as seen nowhere else, but in the range of products organically certified by Pure Company, especially the PURXCEL. Thank you, ladies and gentlemen, for listening.
All right, thank you, Dr. Tony. That was really powerful. Thank you for that amazing exposition on how glutathione or how PURXCEL can really help to deal with, chronic abnormalities and ailments. We're really so excited about that. Thank you for now, ladies and gentlemen. This is getting much more interesting. We're really so glad to have these quality speakers that are coming from all over the world, and we're really so grateful to Dr. Tony. So we'll be moving ahead right now. I beg your pardon. Okay, we'll be moving ahead right now to actually discuss some more about this powerful thing. But we're going to be having a question and answer panel, medical pharmacological pharmaceutical panel, where we're really going to discuss the power of this product and certain questions that you and I and every other person would have in mind. And to take us on this section, we have some very wonderful, top-notch practitioners in the world. The first one I'm going to be calling, the person I'll be calling that will be actually handling this Q&A section. I'm going to be calling all of them, but to actually invite one of our top medical practitioner in Ghana. His name is Dr. Alex Pese-Kodwa. He is the medical director of Hope Christian Hospital, Ghana. Dr. Alex is going to be speaking with a couple of pharmacists and doctors, and amongst them we have Dr. Ofem Eyang. Dr. Ofem Eyang is a consultant physician. He has the sweet thing about him is that he has a certificate in clinical research from Harvard. We also have another powerful doctor all the way from Nigeria, top in the field. He's Dr. Phil Okonkwo. Dr. Phil Okonkwo is a consultant, a medical oncologist. He's the country director of Vankeswa Hospital in Abuja. And also we have one of the top pharmacies in Africa. She's by name Pharmacist Ejiro Foyibo. She's the deputy president for the Pharmaceutical Society of Nigeria, I believe one of the chapters in the Southeast. And then we also have Pharmacist Joyce Daisy, who is a pharmacologist at the Boots Chemist, UK. And guess what? She's also a chartered accountant. And the last and not the least on this very panel is Dr. Zambo Moshu Odile. She's a pediatrician from Rubis Clinic, Cameroon. So ladies and gentlemen, it's really going to be an exciting section. So at this point, ladies and gentlemen, it's my honor to make welcome Dr. Alex Pese-Kodwa to take us on this section. Thank you.
Thank you very much, Charles. You do a wonderful job. And hello, everyone. In this day and age of evidence-based medicine, it is right. And you know right now that you have had a lot of pure science this evening, this morning, this afternoon, depending on where you are. And we have a lot of questions. I know you have a lot of questions on your minds. We have, selected a few, combined a few for our panel to deal with the questions, so we are clear in our minds what the two products can do and what pure science has for our overall health. And so to start with, and not to waste much time, there is this question that I would want Pharmagiro to take. Famajiro, can you please explain what we mean by bioavailability or bioavailable glutathione? What is the difference between just glutathione and bioavailable glutathione? This will help us as it may offer some advantage in PureXL than other products on the market. Can you please explain?
Thank you very much. Bioavailability is a subcategory of absorption, and it is a fraction or the percentage of an administered drug that eventually gets into the system and to the site of action. Before now, it has the belief is that we can say the old science is that glutathione cannot be taken orally, but there are studies to prove now that it can be taken orally. And so what do you have in glutathione? In a PURXCEL, you have a glutathione that is bioavailable, that is delivered to the system in the reduced form, which is good for our body, which our bodies can use. And so what we have is there is no synthesis or production of glutathione. You have a glutathione that is bioavailable, that is ready to be used by the body. And then there is direct delivery to the body and the site of action. So the advantage is that it is readily available. And then the usual synthesis of glutathione is a long process. We all know that glutathione is produced or synthesized in the cytosol of all mammalian cells in the body. Glutathione synthesis actually involves two adenosine triphosphate dependent steps. And the first one is the gamma glutamine cysteine synthesized from the L-glutamic acid and the cysteine. And this is the rate limiting step. In other words, if there is a problem with this enzyme, then glutathione cannot be produced. Then there is no guarantee that in every mammalian cell, in the cytosol of every mammalian cell, that this enzyme will be there. In fact, there is an autosomal recessive trait, which is as a result of deficiency of this enzyme. So for people who have the deficiency of that enzyme, if you give them a precursor to synthesize glutathione in the body, they will not be able to produce it. So there is no guarantee that the three, from these three precursors, these three, the ingredients, these three items that you're supposed to produce glutathione from, there is no guarantee that you can have the glutamate and the glycine readily available and ready to be used in the body. So the advantage of PureXL is that apart from the precursor, which is also in PureXL, unlike other products, you have the precursor, which will still go ahead to help the body to synthesize the glutathione. You now have the bioavailable glutathione, which is now readily available to be used by the body. So while the N-acetyl cysteine, which is also part of the PureXL, is helping the body with glutamate and glycine to produce glutathione, the bioavailable glutathione that is already in the PureXL is readily available for immediate and sustained use while the body is producing the synthesizing glutathione. So what the advantage is that you are able to maintain that level, high level of glutathione, and knowing the importance of glutathione as one of the most abundant antioxidants in the body, and the great role that it plays in the body for a product that is giving you a bioavailable glutathione and at the same time giving you precursors to synthesize glutathione. I think there's no other product that can be better than that. So that is a great advantage that PureXL has over other products in the market. Thank you very much.
Thank you very much, Fam Ejiro. So we always say that when it comes to PureXL, better is better, okay? And there's nothing that beats this product on the market. We have had another question, and I would like Dr. Zambo Mocho to take this for us. Somebody is asking that there are 15 complementary phytonutrients in PureXcel, aside the triactive ingredients. Particularly, can you help us understand the importance of the inclusion of selenium, alpha lipoic acid, moringa, and milk thistle in PureXcel?
Yeah, Dr. Alex, she's going to be speaking in French, so she's just giving a broad view of PureXcel. Thank you.
Oh, okay, okay. So that's fine. Hello, Dr. Zambo.
Hello, doctor.
Okay. All right. Let's go on to the next question whilst we wait for Dr. Zambo.
All right. Maybe
at this point, we shall ask our dear pharmacist Joyce to take this question for us. Joyce, somebody asked, what makes Pure products different from the others on the market? That is the science and the technology, you know, behind Pure. What makes it different?
Well, thank you. Well, the Pure products are superior in so many ways. Time will fail me, but I'll mention a few. I mean, they're backed by solid science and innovative technology, especially the unique triactive technology of PureXcel that delivers the bioavailable glutathione, the superoxide dismutase, and the alloaciminin. The products go through high standard of testing under the supervision of a well-qualified and health advisory board. Most of our products are listed on the PDR. We have 5 of them listed on the PDR at the moment. That is the physician desk reference. That's also the equivalent of the British National Formulary in the UK. You know, when you visit your doctor and he has to make a reference in a book, that is what he refers to. That means that the physicians can recommend our products for treatment, right? That makes it a superior product. This is because of the potency and the efficacy of these products. Now, they are tried and they are tested and they really work. Actually, I have a personal experience. I gave PureXcel to a couple some time back during this COVID period. As it turned out, they were exposed and contracted COVID. The wife did not show these terrible signs of COVID and went on to recover. I spoke to her. She didn't have any symptoms at all, actually. Unfortunately, the husband didn't pull through. So what did they do differently? It turned out that the husband had not taken the product. The wife had taken the product, the PureXcel, right? So we see here that because the PureXcel was able to give her protection, protect her immune system, she went on to show no signs at all. So that, for me, is a personal experience that really proves that these products work and the support of how superior they are in comparison to other products in the market.
Well, thank you very much, Dr. Joyce Dazi, for this wonderful experience you have shared with us. I believe Dr. Zambo is ready. And so in answering the question, she may also share some ideas to us, but she'll be speaking in French. I believe Charles may do us the honor to do a translation for us afterwards. Okay, so Dr. Zambo.
Yeah, Dr. Alex, if we still cannot have, I think let's just go straight to the next person. Thank you. She doesn't have to speak in French if she was just comfortable with English though.
Okay, all right.
Dr. Zambo, over to you. Dr. Alex, I think we'll just move ahead. Possibly network issue. Thank you.
All right, then let's go to our next question. And I would like Dr. Phil Okonkwo to take this. He is a consultant medical oncologist. And Doc, there has been an issue with, ethics when it comes to, medical doctors, medics actually prescribing supplements for their patients. And we would like you to have a touch on it. How can our medical professionals on this symposium, have that ethical, stability to partner with PURE in prescribing the products to their patients?
Yeah, thank you very much for the questions. Let me take this time to appreciate Professor Ben Peters and the entire corporate for putting together this wonderful program. In answering the question, I would say, let's start by understanding that there are basically 5 key ethical principles. And these are truthfulness, confidentiality, autonomy, informed consent, beneficence, normalificence, justice, and of course, I'm going to be touching basically on 2 basic theories. That is the utilitarianism and deontology. Now, this considers that an action as a morally right thing if its outcome or consequences are good for the greatest number of the population. It focuses on the greatest good for the greatest number. Deontology, on the other hand, considers the way things are done rather than focusing just on consequences. This type of ethics hold as its core the respect for fundamental rights, such as the right to truth, privacy, and the fulfilling of promises, while beneficence tells you about doing good for your client. On the other hand, the concept of normalificence tells you to do not harm either intentionally or unintentionally your client. Now, having pointed this out, I'd like to just answer the question in this straight manner. For me, I think it should be a question that we should be considering. We should be considering whether it is always right as a professional or as an individual to put his interest above the interest of his patient. So in my opinion, the questions we should be asking will be: first, will I be putting my personal interest and gain over the interest of my patient? 2, can I, in all sincerity, justify the recommendation or prescription of supplements for use by my patient? Will my recommending the product be against the oath I have sworn to uphold and protect? In answering these aforementioned questions, a few things come to mind. First, do the products work? Are there evidence-based proofs of its efficacy? Can the dosage be regulated? Do they follow scientific principles in the formulation, production, and regulation of their products? The answer to these questions are in the affirmative, a resounding yes. Hence, my submission is that it is ethical because the PureXcel is first and foremost listed in the physician's desk reference or the digital prescriber's reference, meaning it has passed through thorough scientific processes for it to be listed as safe for human consumption. Hence, it's listing in the 2020 PDR. And we can check this out on pdr.net/PureXcel. The scientific research behind the product witnessed the product breaking new frontiers, being the first of its kind to produce a bioavailable orally supplementation of glutathione, GSH, along with a precursor in NAC to aid the body's synthesization of glutathione. Its active technology breakthrough is a combination of the orally supplemented bioavailable glutathione, superoxide desmotase, and a polysaccharide alloasminate. Is indeed a landmark breakthrough, as this is the first of its kind. And with evidence-based proofs and its efficacy, perhaps this fact may have been a significant factor in the decision of the Nigerian Medical Association and the Pharmaceutical Society of Nigeria going into strategic partnership with PURE on the use of the PureXCel in the management of oxidative stress, especially as it relates to chronic health conditions. It is the desire of every medical practitioner to see the improvement in the overall health condition of his or her patient. I therefore believe, based on the abounding testimonies and the clinical evidence, that PureXCel has helped largely alone and in combination with other drugs and supplements to bring about improved health conditions. Thus, on those it has been administered on. It is also important to note that in our society where balanced diet is not being practiced, supplementation must be encouraged as a proactive means of boosting immunity and prevention of disease conditions. Finally, ethically, we put the patients first, but we must also remember to put ourselves into consideration. Hence, with products like PureXCel, we have a proven record of efficacy. It certainly cannot be unethical or wrong for medical professionals to partner with PURE in the use of our products to improve overall health through supplementation and reduce cases of ailment which could have been prevented via adequate supplementation in the first place. Thank you very much.
Thank you very much, Dr. Phil. And of course, in this day and age, we are in a different dispensation where the relationship between the doctor and the patient is now informative, no more paternalistic relationship where the doctor decides for the patient. And so it is ethical that what the patients need to know, make them understand so they can choose appropriately. But last and not the least of them, we would want to ask Dr. Ofem the final question. Doc, please could you?
Yeah, and Dr. Alex, he has just about a minute.
A minute, yes. Doc, just touch on this. You are a clinical research scientist. What does it mean to be, for a study to be double-blind, placebo-controlled human studies? What does it mean? Kindly touch on this for us.
Good evening, all. I hope you can hear me.
Yes, sir.
Yes, thank you, Alex, and thank you, Charles. Well, I'll go straight. First, I'd like to just say that it's an opportunity like no other for us to be able to speak about double-blinded studies. A double-blind study is actually one in which neither the participants nor the experimenters know who is receiving a particular treatment. So double-blind, that means both the experimenter, that is the researcher, and the participants, they do not know what particular treatment they're taking. And this procedure is utilized to prevent bias in research results. Now, double-blind studies are particularly useful for preventing bias due to demand characteristics or the placebo effect. So in a nutshell, because I have just a minute, I'm sure that will clarify, but it is important for a symposium of this nature for us to just touch on a few other things. If my kind colleague and moderator, Alex, would permit, it's important for us to know that amongst the study designs, randomized control trials under which double-blind studies would fall under are the highest level of evidence, for clinical experimentation. And it is also known that in some of these instances, it is regarded as experimental as against non-experimental. And the motivation for the use of randomized control trials is to remove confounding. Confounding is a determinant or cause of outcome that is distributed unequally. But because I do not have time, I thought I was going to be able to have some time to really touch on randomized control trials and what randomization is. I will still go ahead until you stop me. Randomization is, the allocation of.
Can you summarize?
No, I've given the summary already. I've already told you.
Right.
A double-blind study, which is what you actually asked. I said in summary, a double-blind study is one in which neither the researcher nor the participant knows who is receiving a particular treatment. That is just a simple thing. So that's what a double-blind study means.
All right, sir. Thank you very much, sir. Charles, at this point, we've had, but I think there are more questions on people's mind, but because of time, I will leave it here.
Yeah, Dr. Alex, I promise you we're going to have more and more of this section, because these products are really doing great and massive things. So thank you so much for that wonderful coordination. Thank you, Dr. Anak. Thank you, Dr. Phil. Thank you, Pharmacy Joe. Thank you, Pharmacy Joyce. And thank you, Dr. Zambo. We're really so excited that you could actually deliver like that. So right now, immediately, ladies and gentlemen, we're going to be moving over. Now, they have talked about the product, powerful product. But one of the reasons why Pure is actually where it is right now is because these products work. And I'm going to be bringing a top leader, global leader, someone we respect so very much. She's the top in her field, and she's changing lives continentally, changing lives globally. Ladies and gentlemen, it's my privilege this evening to make welcome no other person but Mrs. Teresa Getz, Chairman Black Diamond for Pure. Thank you so much. It's a privilege to have you, ma'am.
Thank you, Charles, so much for introducing me. And I am so excited to share my screen with you. So you guys, good evening, Africa. You have got to be so excited by what you just heard. Medical experts, the very best in their field, sharing with you the power of these products. And so guess what I get to do? I get to show you how do you get the products, how do you get your products paid for, and how do you earn extra reoccurring income? Because when you have great products, you have a phenomenal opportunity. And so I'm going to walk you through this opportunity and show you that this Pure Prosperity Plan will allow you to build the life of your dreams. Now, I don't know what that looks like for you, whether it's a new vehicle, whether it's that dream home in the middle of the screen, whether it's bringing your spouse home from their job so they can raise a family, or traveling the world. Pure has an amazing compensation plan. It's a binary and a unilevel, 2 compensation plans in one with 10 different ways to earn money. And so you guys, you can see right here that there's 10 ways, from a car program to luxury trips, and then 8 different payouts within the compensation plan. There's quick, upfront, fast money by buying wholesale and selling retail. There's a mid-level income, and there's a residual income. So let me take you through this quick journey, and you are definitely going to want to be a part of Pure. So the first way is you buy it at wholesale, you sell it at retail, and you keep the retail profit. It's super, super simple. The second way is every time you enroll somebody with Pure, they get the products at a wholesale price, wholesale discount, and you make a pack bonus off of their first initial order and every recurring pack after that. You can look at your dollars for your specific country. This pack bonus goes from $15 to $30 to $50 to $100 off somebody enrolling and getting started with a package of product. Now, y'all, you just heard the power of the products. Everybody gets started on a package of products to change their life. Now, when you enroll that person, you are their sponsor. You're sponsoring them into the program. So not only do you get a pack bonus, but you get a sponsor bonus, 10% of everything they order for a full 90-day window. That is very exciting, you guys. Pure pays very, very well. So let me give you an example. Your total immediate bonus. When you get involved, you guys, as you are hearing these doctors speaking, did you not think of people that you would want to go share this with? Your mom, your dad, your brother, your sister, your friend, your boss? When you enroll them, you get an immediate bonus total of your pack bonus and your sponsor bonus. Take a look at the chart, it's there. And what I love about this is if you come in with a 50-point order, it qualifies you in the plan to earn for 4 weeks. If you come in with a 100 PV order, it qualifies you for 8 weeks. 250 is 12, and a 500-point order is 16 weeks. The reason we do that is so that you can get a package of products and stay active in the compensation plan. But look to the right. If you go sign up your first person, look at the package that they come in with. You get the sponsor bonus and the pack bonus, and look at the total payout. $20, $40, $85, or $150, and you can correlate that with your currency in your country. Now, the reason we talk PV and the products have a point value attached to them is simple. The dollar is different everywhere. You've got the Kenya shilling in Kenya, you've got the Naira in Nigeria, you have the US dollar in the US. And so we're gonna talk point values. But here's where I got excited. Over 9.5 years ago, my husband, John, and I saw what you're seeing today. We saw that the products were powerful, that they were life-changing, truly impacting people's lives. And we saw that if we would go out and start 2 teams, if we would sign somebody up on the left, look at your diagram on the screen, and somebody up on the right, and start 2 organizations and teach those to duplicate and do the same thing, that we could build a massive organization. Because y'all, this company pays a team bonus on the binary, not just from the people that you sponsor, but from the ones they sponsor and they sponsor and they sponsor to infinity. And I got excited. You guys, the company pays 10% of your lesser team volume. Another way to say it is 5% of the left and 5% of the right on matched volume. We never flush extra volume. It carries over to infinity, week in and week out, until you match it on the other side. And this team bonus is paid weekly. Here's an example. You go out and this week you say, I'm doing this, I'm going to work, I'm sponsoring a few and I'm helping them duplicate, so forth and so on. And you may be the person that sponsors 4 or 6 or 8 or 10. And I encourage you to do that. The more people that you share this with, the faster and bigger you're going to build it. So an example, you have 3,000 points on your lesser leg. You have 3,300 points on your bigger leg. The company's going to pay you 10% of the lesser team volume, which is $300. But guess what? The 300 extra points on your big leg carries over and banks for you until you match it on the other side. That's called spillover volume, and it never goes away. Now, the most important thing you can do in Pure is share and chase ranks, because the more ranks you're chasing, the more lives that you're impacting and changing. So I took one look at this and I wanted to be a gold director. I looked down at this gold director and it's roughly about $35,000 a year in the US. Who wouldn't change their life with $3,000 a month extra? That's what I set my sight on. I didn't look down here at these big ranks right away. I probably would have disqualified myself, but I achieved the rank of gold director, and it's happening all over Africa, and it's waiting for you to step to the plate and do the same thing. It wasn't long after that we were able to achieve the diamond rank and then move on to black diamond presidential and chairman. So I stair-stepped it. But the power in this is going and helping your team move through these ranks and look at the respective incomes on the right-hand column as you move up through the ranks and get people on these products. Now, there is another way you get paid, and I think it's probably the most exciting, because you're in business for yourself, but not by yourself. We have what we call a generation bonus, and this is attached to everybody that you sponsor and on down. And they pay you generationally on generations of silvers to infinity. So you know what this means? It's about going out and working with the people that you enroll. So whoever enrolls you, you're going to get back with the person that invited you on the Zoom. And whoever enrolls you is going to partner with you to help you see success. And the generation bonus is amazing. How it works is you get enrolled and you go sign up your first person. It's like you just have a son or a daughter. And they go sign up their first people, and now you have grandsons and granddaughters. And then you have great-grandsons and great-granddaughters. And look at how many generations of silvers you get paid on. You guys, the generation bonus can be one of the biggest parts of your paycheck. Now, something else Pure does is they provide us with a rank bonus. See why ranks are so important? And the very first rank that they pay this out on is platinum. How would you like to earn a $1,000 bonus for hitting the rank of platinum? Or maybe you have your sights on that crown diamond rank, and yes, you see the screen right, you can earn a $250,000 rank bonus. Here's the terms and conditions. They're simple. The first time you hit platinum, you get $1,000. The first time you hit sapphire, they pay out $1,000 up front. They give you 10 weeks to hit it again to pay out the extra $250, so forth and so on. Now, another bonus. Can you believe all these bonuses I'm sharing with you that we love to talk about in Pure is a lifestyle bonus? How would you like to have a bonus that lets you do what you want? Pay off credit card debt, pay off college education for kids, buy a new wardrobe, maybe travel, maybe do whatever, redesign your home, whatever it is that you're looking for. Do you know from the very first rank, which is Bronze Director, if you hit any of these ranks, Bronze to Emerald, 2 times in a calendar month, you get $50 to $1,100 a month. Just an added bonus, but it doesn't stop there. They then step it up from diamonds to crown diamonds. And what they do there is every week that you hit one of those ranks, you get the respected number of shares. Now, what I'm going to tell you guys is that's $1,000 a week when you hit diamond. If you hit diamond this week, the company's going to stroke you an extra $1,000 paycheck. If you hit blue diamond, they're going to give you $2,000. All the way up to that crown diamond rank where you could earn 10 shares, $10,000 in 1 week. So set your sights on these goals because it's not a matter of if you get there, it's only a matter of when that you get started and you go for it. Now, if the payouts aren't enough, how about luxury dream vacations all across the globe that you get to travel to and the company, it's on their dime? Places like, you see it on the screen, Paris and Spain and Bora Bora and London and Rome and Italy and Canada. How would you like to travel to luxury destinations that you simply earn by building yourself a business? And the best part is you can help team members achieve those trips and travel together. So we look forward to seeing you on one of our luxury incentive trips. And then to top it all off, who doesn't want a luxury car? Y'all, in Africa, you have a luxury car program. When you reach the rank of diamond, you're eligible to participate in this car program. So whether you're looking for a BMW or a Mercedes or a Range Rover, whatever the car is that you dream about, how would you like to earn it? Pretty spectacular. So guys, before I turn this over to some amazing leaders, and this is the best part, is you've heard the science, you've heard the medicine, you've heard the doctors, you've seen that this compensation plan pays and pays very handsomely. Before I turn it over to my leaders, I want to make 2 closing remarks. But the best part of all of this is I'm going to introduce you to real people with real stories. And as you're hearing them talk, I want you to ask yourself, why not you? Why not you and your family achieve the goals that you desire? You know, I love what Robert Kiyosaki says. He says the size of your success is measured by the strength of your desire. So if you have the desire to change your life, plant your flag here at Pure, because your life will be forever changed if you roll up your sleeves and go to work. And Warren Buffett, never depend on a single income. Make an investment to create a second source. That's the vehicle called Pure. So we have the products, we have the compensation plan. Now I'm going to turn it back to Charles to introduce amazing leadership that's going to be every step of the way with you to show you how to achieve your goals and dreams. Thank you so much, Charles, for letting me share.
All right, thank you so much. Yeah, thank you so much, Teresa, for that amazing exposition on the power of Pure. We've talked about the products, and now we're talking about basically the business part of it. So thank you so much for that, great. Teresa Gates is one of our top leaders, and we are really so proud of the things she does. At this point, ladies and gentlemen, I want to welcome, just like she said, we're going to be looking at some other top leaders and the wonderful things that they have also been able to achieve with this wonderful company that's changing the health of people and also changing their pockets. We're really so happy about this. So ladies and gentlemen, it's my honor this very moment to invite up a presidential Black Diamond with Pure. She is a top leader that's recognized globally, and she is a champion in Africa. Ladies and gentlemen, I present to you Emmy Perez, a presidential Black Diamond. Thank you.
Thank you so much, Charles. Thank you so much for everyone for letting me be on this call this evening. What an honor, and what an incredible call this was. Did you see all the incredible education? Did you see all of this and all the physicians and all of the clinical research that's been with these products? So I want to say thank you for letting me jump on and just share our story and our journey with Pure. My husband, Lionel, and myself saw this company 8 years ago. It was an answer to a prayer. And if I can just have you all think about this, what if one opportunity could change your life? That's what happened with us. Prayer, Pure was an answer to a prayer for us. My husband is a corporate pilot, lost his license to fly because of his health. We had a wake-up call on his health. We were chasing his health. It's a terrible place to be, to try to chase someone's health. And basically, Pure was an answer. We found it, we jumped in, we got on the products. Within 2 months, my husband lost 25 pounds, but he got off of 4 prescription meds. He had been presented with high blood pressure, high cholesterol, gout, pre-diabetic, and high triglycerides over 500. So we were on the regular journey of being on a lot of medications. I was the pharmaceutical rep for 20 years. I understood he needed to be on medicines, but with all of the elevated liver enzymes and all of the flushing and the constipation and the side effects, it was getting out of control. He's the one that said, Amy, is there any way we could bridge nutrition with medicine? Is there any way, I could pay to be healthy versus paying to be sick? And that's when we started our journey with Pure. Again, it was an answer to a prayer. So we jumped in, and then within those 2 months, he got off of those 4 prescription meds, got his license back to fly. But the best part has been consistent. He goes for a physical every 6 months, and he passes his physical. He is flying all over the world. But the important thing is the products work. It helped my family, our whole family, on just enjoying Pure. The other part was a plan B. When you lose your income, that's a scary place to be also, because guess what? The bills keep coming. And so that's where Pure was another answer to a prayer for a plan B, just in case, wiggle room, just in case of myself with my corporate job getting a layoff and us never to be in this situation again. So we jumped in, started building teams on top of teams, sharing Pure, just get a membership. And that's what I'm calling you today, a call of action. Get the membership, get these products in your body. And what happened with us, this plan B in 1 year turned to plan A with checks weekly. In fact, these 8 years now, we have had a check every week. Every week. Do you realize how important that is? Reoccurring residual income. This plan B now is plan A after 1 year of just focusing on with my regular job and Pure. And now working from home for 7 years. And now during this COVID crisis where people have to work from home, people are looking for ways to work from home to make extra income. We've been working from home. Our business is exploding. We just hit Presidential Black Diamond with checks now up to $24,000 in a week. People, we are learning and we are partnering with Africa, and you are all just pioneers, starting ground floor opportunity. And now because we're partnering with Africa, you're seeing the results, and you're seeing incredible physicians that are jumping on Pure and bridging nutrition with medicine. With Dr. Atuk, Dr. Ray, Dr. Toyin, so many physicians, so many pharmacists, and so many people are being pioneers and taking this step. If you're worried about your health, Pure's the answer. Pure's the solution. If you're worried about your finances, it's simple. Pure is the answer. If you are looking for something, don't miss out. Pure's that answer. Pure's that vehicle that's going to take you where you want to go. Be a blessing. Jump in, join us, partner with us, and let's go change lives. Thank you so much, Charles, and I'll turn it back to you.
Wow, thank you so very much, Amy Perez. Thank you for being a hero for so many lives, so many families and lives are saved by the power of this product. Thank you so much for all you do. Ladies and gentlemen, that has been Amy Perez. She is a presidential Black Diamond. She's a presidential Black Diamond. We're really so glad and happy at the things that she's been able to do. This company is really transformational because the products work, just like you've heard from the doctors. We're also going to be bringing out other leaders in Africa that they have been able to do some massive things. Every single place you see value, you are also going to find money. And so these people have been able to buy into what every doctor has talked about, and they know that they can change the lives of people and family, and they are in return getting value for their ability to help others. So ladies and gentlemen, it's my honor this evening to make welcome our Chairman Black Diamond. This is a transformer. He's a leader of leaders, someone that's actually helped so many people, you know, enjoy the benefits of this product. So ladies and gentlemen, it's my honor this evening to make welcome Mr. Moses Eberemo. He's the Chairman Black Diamond. Thank you, sir. All right, Mr. Moses, you are unmuted.
All right, can you all hear me?
Yes.
All right, this is powerful call. Thank you. This is a powerful call. Thank you very much, Mr. Charles. Thank you for everyone that have spoken about the entire Pure product. I would love to say this. I'm so excited today being part of this opportunity, being part of Pure, and I can put everything today because the product is working. So if there's anyone who is excited about the true effectiveness of our products, I'm one of those persons, because everywhere I go to, people kept testifying. Today, I had an event, a meeting, and a lady was actually testifying about Pure products. And she was saying it so emotionally to the point where she was actually shedding tears, bringing her tears and all of that. She was so emotional about it. What happened? She said someone kept talking to her about Pure, and her mom was very sick, but she kept refusing. And she kept refusing, she kept turning down the opportunity. But when she knew that she's going to lose her mom if she doesn't find a way out, and then she finally said yes to the Pure opportunity. Today, for the first time, she said her mom is so healthy. The mom is talking very well. The mom has a serious eye issues. Both of them, one she did surgery, the other one she was yet to go to surgery. Today she can see clearly with the eyes. These testimonies are just too much for one company. But then I'm so happy because the best form of expansion is a satisfied customers. When people are truly satisfied, they go all the way for it. And Pure has given us a true product in Africa, which is something that most companies have not been able to really get down to us right here. But we are seeing true product that is genuinely working, products where customers are real, not just because of the money, but because we are getting value. So concerning all the medical ideas today, I truly appreciate. Concerning the ongoing concept coming in, I truly appreciate. I want to say thank you once again to Pure for giving us the opportunity, because most of us are currently on this level today because we have the best product, and I can't take that for granted. So once again, thank you, Pure. Thank you, entire corporate. Thank you, the entire health team. I believe this will go on and on and on and again. Thank you very much, Mr. Charles. Thank you.
Well, thank you so much, Mr. Moses, for the great things you're doing, changing lives and family. We're really so glad. The next leader I want to call is someone that's also a coach and someone changing the lives of so many. He's actually one of our success stories in Africa. Ladies and gentlemen, I present to you Mr. Innocent Daniel, a Blue Diamond executive. Mr. Innocent, over to you, sir.
Yeah, thank you so much, Charles. Can you hear me?
Yes, loud and clear.
Okay, well, it's been an amazing time, listening to this expose from our product by doctors and pharmacists. I've been listening, and I can see a great future. I know we are in for a great thing. The testimonies of our product is amazing. I always tell people, if only Pure came to Africa with its claims, I think we have done well. Now we have all our product as stand-alone. Each of our product is an industry. And that's where I look at it. Each product of Pure is an industry of its own. When some months back, when I did intensive research on the market share of each of our products, I discovered that each product of Pure is actually a company on its own. So for me, having Goyin also joining this league, and remember, like we know that Goyin is first one of the major products of this company in the US as well promoted. So I see something massive. I see a future, and once there's efficacy, testimonies are everywhere. Our product, our business is not going in the line of testimony. So I'm so excited what is happening right now. Like I was telling someone the other day, somebody said every other company buys Pure product to complete what they have, but Pure is complete on its own. And that's because the three fundamental health thing was really dealt with, which is cleanse, balance, build. So for me, I think we have really done well in Pure, and I believe the future is massive. And I want to encourage every IBO here. This is the best you can find in anywhere in Africa. There's no match anywhere. So, and it shows that the economy of Pure is huge. So, I can tell you, we are stepping into something great in the next coming months and coming years. So I just want to let everybody know that we have something great. The doctors amongst us are doing well, pharmacists. Each of our group, we are attracting a lot of people because of the efficacy of this product. So I want to thank Nigeria Medical Association. I want to thank Pharmaceutical Council of Nigeria for what they've done with Pure. And I want to thank Dr. Ben for, being able to bring these two bodies together to be part of this first of its kind in Nigeria. So I really appreciate the leadership you have provided at that level to make this thing, more professional, not just people on the streets, but professionals being part of what we are doing. So for me, that is the biggest news of Pure. That is the biggest story behind Pure in the continent of Africa. So Dr. Ben, thank you. Salute your leadership. I appreciate Dr. Tony, everyone that has been part of this. And I want to thank all the IBOs for the great work you do. And I believe that more are there for us in the future. So thank you, Charles, for giving me the opportunity. Thank you, Dr. Ben. I wish.
Thank you, Mr. Innocent. Thank you so much for that wonderful speech. Ladies and gentlemen, that's been Mr. Innocent. We have so many great leaders. Unfortunately, because of time, we'll just take two more. So it's my privilege and honor this very evening to make welcome another top leader in Africa. And he's a top leader that we respect so much, and he's by name Dr. Etuk Obong. Thank you, Dr. Etuk. Over to you, sir.
Hello.
Yes, we can hear you, sir.
Okay, sorry, let me put on my radio. I just had to pull over. Okay. Good evening, everybody. Good morning to the rest of the world, or good day. I just want to say thank you so much for this opportunity, and also want to thank all the great speakers today, all the doctors and the pharmacists that presented. And truly speaking, Pure has really, really changed a lot of lives. I'm part of those people today. Every day I woke up feeling so grateful because I said yes to this opportunity. I'm grateful to the fact that as a medical doctor, we just do recommendations. It's God that perfects the healing. But now I've actually had something with us, which we are using as a complementary therapy for patients. And the kind of results we get every day gets me motivated. And I'm thankful to Pure because Pure has not just changed the narratives alone for us as doctors, because I believe many years back, if you meet an average doctor and you told them about supplements, they don't really, really believe in it. But today, even in my team and across other teams, you see doctors are, partnering with this company. You can see the endorsement we've gotten from NMA, we've gotten from also from Pharmaceutical Society of Nigeria. That's to show you that we have a product that has so much of value. It's a pretty thing, and the most amazing thing about it is the fact that people get value of what they're paying for. I've never seen anybody that have recommended Pure products for that has taken for at least a month to 2 months that doesn't have something good to say about it. So for me, if you have a great product, that means you have a great business. And the financial aspect of it has been amazing for me too, because as a doctor, if you really, really do research a lot, you know that across other part of the world and continents in other continents, you understand that Africa is actually one of the places that doctors doesn't really get paid enough. And me doing Pure as a side business and also kind of incorporating it into my own profession and all, and getting the kind of rewards I get weekly from the company, all I can say is that I am grateful. And I want to appreciate everybody, Pure management over there in the US and the ones in Nigeria for everything that they're doing. All I want to say is that they should keep up the good work. They should keep on bringing in good products. I'm so excited that we are having going in because my amiable leader that I respect so much, the likes of our Queen of Africa, Mimi Perez, she told me a lot about going even before I heard about it from the company. So she has always been saying that going is a very powerful supplement over there. And I'm excited that we are going to have this. That it actually means that the market is going to get bigger and bigger. So thank you so much, sir. And thank you, Mr. Charles, for the opportunity. And I can tell if you're on this call, take a leap of faith, join Pure.
Yeah, thank you so much, Dr. Etuku. I'm really so always happy to hear from you. Thank you for the great things you do for Nigeria, for Africa, and by effect for the whole world. Thank you so much. At this point, listen, I will be calling the last leader. We have so many leaders on this call. Thank you for being on this call. But at this point, I want to call our leader from Ghana. He's our Ghana giant. He's a top leader, and we're really so excited about the number of lives that he's actually touched in the country of Ghana. Ladies and gentlemen, I present to you Mr. Evans Asari.
Hello, Charles, please, can you hear me?
Yes, I can hear you loud.
Good evening, everyone. We give respect to all leaders on this call. This is an amazing day, a day that we will remember about what Pure has been able to plant in our lives. It's been amazing, and we thank God for all the speakers, the doctors, and the pharmacists. The knowledge was very deep, and thank you, Madam Teresa, thank you so much for that amazing presentation. Hey, I know maybe if someone has invited you today, you are on the call and you're taking decision whether to join this company or not. But I just want to encourage you, like Dr. Max Moreau said, that it's decision that makes a man. I want you to take decision today and you will never regret. We took decisions some few months ago, and we are getting to see some money we have never dreamt of coming into our account every day. That is just a composite blessing. But the real deal is the health package that God has gifted us through this wonderful company called Pure. We just want you to join us because if you have any doubt, you heard what our experts are saying, the deep knowledge they have shared about our product and what our product is able to do, for which reason they have also partnered with this company. So join us, let's change our life and help change other lives. And you will be a testimony to the world. Thank you very much.
Thank you, Doctor. Thank you, Mr. Evans Asari. Thank you so much for the great things you're doing. Those were wonderful words. Thank you, thank you, thank you. Ladies and gentlemen, it's my honor this evening to bring back our president. You've heard his name over and over again, and we are really so glad at the transformation that he has actually brought to the country of Nigeria, Ghana, South Africa, and by extension, Africa and the world. Thank you so much, Dr. Ben.
Hey, Charles, thank you so much, Charles. Wow, what an amazing event we just had. Almost 700 medical professionals from all around the world, from Nigeria to Ghana, South Africa, United States, Kenya, Cameroon. This has been an incredible, amazing event. I want to say thank you to all of our speakers, all of our
Sorry, sir, we're losing you.
leaders, all of
Oh, sorry for that. We're going to have Dr. Ben back, and thank you so much. I believe we're going to have him back very soon. While we wait for him to come back, it's very important for you to really understand that everything you've heard is because these products actually work. You can go make your research, like Dr. Phil said, on the pdr.net, and you're going to find our products claim. Okay.
Hey, Charles, can you hear me? If you
Yes,
want
you're
to
back.
just bring John Getz to wrap up. Yeah, if you want to bring John Getz to let him wrap up. But I just want to say thanks once again. Amazing event, great speakers. We got thousands of products shipped all across Africa. We got an amazing car program. If you want to get that luxury Mercedes, you can. If you want to get that luxury Range Rover, you can. So we're very excited about closing the year strong. It takes you, it takes every one of us. So thank you, everybody. And I'm going to invite one of our top leaders from the United States, Mr. John Getz. I'm going to have him bring the program to a close. But once again, thanks for letting us come into your homes and your families. Special event, special leaders. Let's go out there and.
Well, thank you, Dr. Ben. Thank you, Charles. It's John Getz. And I want to say we want to wrap it up today, you guys. Thank you for taking time out. It's the people that stayed in this room all day that's going to take your business to the next level. There's some people that got on, got off, got on, got off. But the ones of you that stayed on here today to get the information, to take your business from here to there is what's going to grow. Not just for you, not just for your family, but you're going to be impacting so many other lives out there. So, you know, Teresa and I are so excited for each and every one of you guys. What I want to share with you today, if you're looking at this the very first time, get started, get these products in your body. You heard everything everybody shared with it. The business plan is the best out there. Nobody's going to pay you better than Pure. And I'll tell you, what's nice about this, we have seminars going on all the time. I want to encourage you to get on the ACE 90 every Monday. Charles will get that out to you. We have the ACE 90 on Mondays. We have a business presentation overview that you can plug other people in. You don't have to know everything today. You just plug people into these presentations, and we get them done within 35 to 45 minutes. You plug them in, they get the information, they hear about the products, they hear about the opportunity, and they hear how they can make money and help others. And then Friday, we have a stockist program. So what I would share with each and every one of you as we close out now, to get involved, get products in your body, and you have the best company that you'll ever have. You can be proud of what we have here with Pure as you go out and share. You heard from medical doctors, people high up in their industry. You've heard people that are making some great money, some great income, from Dr. Atuk to Moses to Evans, to all these people that are making things happen, Innocent Daniels. I'm telling you, lives are being changed. You be a part of it and come join the Pure family, because that's what we are. We're family. We love each and every one of you, and I'll turn it back over to Charles. Charles, you're a blessing. Thank you so much for all that you do for all of us in the world of Pure.
Well, thank you so much, Don. Thank you to every leader. Thank you to every doctor. Thank you to every pharmacist. Thank you for everyone that actually made a point of contact. We are really so blessed and so glad that you came. It's been a good one. This is recorded. You're going to find it on Facebook. You're also going to find it on YouTube in a very short time from now. So thank you very much for attending, and want to say from Pure and everybody on Pure Corporate Africa, Pure Corporate globally, want to say thank you so very much. Have a lovely day. Thank you.
If you feel like a room without a roof, 'cause I'm happy. offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't nothing bring me down. Your love is too high, bring me down, can't nothing bring me down. I said, take now, bring me down, can't nothing bring me down. Your love is too high, bring me down, can't nothing bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't nothing bring me down. The love is too high, they bring me down, can't nothing bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Clap along if you feel like that's what you want to do. It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't nothing bring me down. Your love is too high, they bring me down, can't nothing bring me down. I said, take now, bring me down, can't nothing bring me down. Your love is too high, they bring me down, can't nothing bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness love is too high to bring me down. Can't nothing bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness. The master's piece. Yeah, you live pure, I live pure. Then we all live the pure life. We all live in our eyes, man. We all live the pure life. Put a smile on your face, get this energy around your race, oh yeah. If anybody say you can't do it, look them in the face and say, watch me do I'm no Elvis, yeah, but I'm here to rock and roll. I told that one tell me, yeah, shama about me, Joe. Cause I got this energy, be Genevieve energy. People united, reaching everyone, call it synergy. Yeah. Easy, 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 go. Let's live a pure life everywhere we go.